Good afternoon, everybody, including those online. So what I'm going to do is I'm going to run through some highlights of my research over about the last 20 years, and then we're going to talk about the opportunities that there are in Dundee University. So this is an ultrasound system just here. As you can see, this is Karen, and she's undertaken an ultrasound examination of this patient. And you'll see the transducer that she's holding is being pressed against the skin. The transducer is generating ultrasound waves which pass into the patient, and then an image is formed, which you can see on the screen at the top there. So what you're looking at the screen is this patient's artery, and he's obviously got a problem with circulation in his legs, and so this is an ultrasound examination of the arteries in the leg. All right, so let's talk a little bit about one of the diseases of arteries. This is atherosclerosis. Everybody here has got some version of atherosclerosis, hopefully relatively minor. It's a worldwide condition, and it's associated with fairing up of the arteries, which you can see just here. And this is a kind of microscopic examination of a carotid plaque. This is the disease in the carotid artery. And if that plaque ruptures, then the contents will spill downstream, and this leads to the clinical events such as heart attack, if it's in the coronary arteries, or stroke, if it's affecting the brain. So a lot of attention is paid both in clinical diagnosis, clinical therapy, and in research in this area. So this is a typical ultrasound examination of the carotid artery. And this, what's happening now is that the transducer is being pressed against the neck. The carotid arteries supply the brain. And what we have here in grayscale is the B mode image, which is looking at the tissue structure. The disease is around about here somewhere. The colour is a colour flow image where we're looking at blood flow in the carotid artery here. And then you will see at the top, the operator has got this line coming down and is taken these blood velocity waveforms from this particular location within the carotid artery. So here are the blood velocity waveforms, and being outlined in blue is the maximum velocity. So as a result of this examination, what the operator is trying to get is a measurement of the peak systolic velocity, the peak blood velocity within the carotid artery. So that's this number, which I've outlined in red. So the peak systolic velocity, in this case, it reads here, 184 centimeters a second. So now going across to this table, we've got velocity on the left-hand side and the percent stenosis. So this is the degree of the diameter of the vessel which is being occluded by the disease. And we can read across here. So this patient has got a stenosis of 50 to 69%. Had this patient had a stenosis of more than 70, they would have been considered for carotid surgery. Not just this number, but other forms of clinical evidence as well. But the point I would like you to gather from this is that as a result of this examination, that numbers are being generated. And this is, in this case, this is a physical measurement of blood velocity. And these numbers are being used to inform decisions on treatment. So I'm a physicist. Physicists care a lot about errors. And so the next slide is concerned with looking at errors in the measurement of blood velocity using an ultrasound system. So on the left here, we've got a string phantom. And this is exactly what it sounds like. There's a piece of string being driven around a loop here at a known constant velocity. And then in the middle, we've got the ultrasound examination of this string. Here's the string just here. So we can make measurements of the velocity of the string and then compare that against the true velocity to get this data. So the true velocity is 0.61 meters per second, and this is the measured velocity. Now you might be surprised that this velocity is in error, often by quite a lot, 20, 30, 40%. So just bear that in mind, and we'll come back to that, and I'll round up the kind of aims of all of this in a couple of slides' time. Right, so the next thing we need to know is that the blood flow patterns in arteries are generally complex. If you read the textbooks, especially the relatively simple textbooks, they'll describe blood traveling in straight lines parallel to the vessel wall. That does happen a bit. But here you can see in the carotid artery, the flow is highly complex. So this is the region of, this is the internal carotid artery where you get a lot of disease, and there's flow going all over the place just here. So for a true characterization of blood flow, we need 3 spatial components, X, Y, and Z, 3 velocity components, Vx, Vy, and Vz, and 1 time. So that's 7 components in all, 7D flow. That's what we ideally need to describe complex blood flow. Let's have a look at how ultrasound does in this regard. So we have our blood velocity waveforms on the left-hand side just here. So these come from a relatively small area within the artery, so that's 0 components. There is only 1 velocity component actually being measured in the line of the beam, and I'll talk about that in more detail in a minute, and time. So we get 2 components for spectral Doppler. Looking at colour flow, we've now got a 2D map of flow, so that's 2 spatial components, 1 velocity component, and time. So we've gone up from 2 to 4D, but it's not 7D. So let's just stop for a second and let's have a look at what the drivers and opportunities are. So first of all, we need better diagnosis of disease. One of my vascular surgery colleagues told me many years ago that 10 operations are performed to prevent 1 stroke. So anything that can improve those numbers is going to be helpful. So concerning diagnosis and the use of ultrasound, physical measurements are being made. Blood velocity is one, others could be made, such as volume flow and especially wall shear stress. Now, wall shear stress is a very, very important quantity. It's concerned with the way that the blood creates a viscous force on the arterial wall, and this viscous force is known to be associated with initiation of the disease, progression of disease, and rupture of the plaque. So if you can find good, efficient ways of measuring this quantity, then that hopefully will help. And finally, accuracy. We need methods to validate measurements, which are called phantoms, and we need improved technology. And ultimately, we need to measure 7D flow. So for the last 20 or so years, my research has been divided into 3 areas associated with that type of approach. First of all, the development of testing devices called phantoms. Secondly, use of those phantoms to look at error measurements, and then new and improved measurement methods, all around the idea of underpinning the science for clinical applications and improving those clinical applications.